Yeah. Yeah, and I think that that's a big question about that's one thing, and then we have to go that if they don't. But I think that's right, you know, education about presentations and then really yeah, basically it's about the very and then my needed doing the evidence retrieval and then it's yeah, no, that's before. I would sorry. Problem.
I know that's. I just. Yes, is Marlene here as well?
She is. I'm gonna actually, I'm not sure.
And for Matt as well, yeah, I'll introduce the three of you. I just wasn't sure who would be in the session, but okay. I put together a slightly dramatic slide.
No, I'm not.
Yeah.
Yeah.
And so you know, when I go from here, I just think it's, you know, it's
Yeah.
too early, obviously, for you to say anything.
Yeah,
but
yeah.
Do you want to say anything? I can just introduce.
Yeah,
that's fine.
yeah.
And then just say that you, I'm not sure that we necessarily follow up with stable capture.
Yeah. Yes, they have. And you have to be good at that.
Yeah, I think it's hopefully gonna work. Let's see. It's really basic.
Yeah.
But yeah, so and I've created a Google folder for people to dump stuff in.
Yeah, that's great.
Okay, great. Thanks.
They might like me. Might have been confused.
About the two, yeah, yeah. Welcome everyone. I think we'll just give it another couple of minutes in case we have some late arrivals before we start. It's nice to see you in person. Okay, welcome everyone to this session today on strengthening norms and policy frameworks to drive acceleration toward universal hand hygiene. And thank you so much for joining us. Hopefully this is going to be a really dynamic discussion about hand hygiene and how we can achieve those goals on the slide today. For those of you who don't know, the session is very much centered on discussion. So we have a brief quiz to warm us up, and then a short framing presentation where we will provide you with information on what our starting point was and what WHO and UNICEF have been doing over the last 9 months and where we currently are, and request some inputs from you, some specific inputs, but also just really want to hear your thoughts on what it is that we're planning, how it fits with your experience, and opportunities for future engagement in the process as well. My name is Joanna, Estevez Mills. I work at WHO in the Geneva office, and I focus on the hand hygiene work. And I'm the lead technical officer for the guidelines. Okay, so I think, I'm going to welcome Anne Thomas, who's the Senior Lead on Sanitation and Hygiene in UNICEF New York, to welcome you formally and provide a few opening remarks. Thank you.
So thanks very much, Joanna, and I'm really delighted to welcome everyone on behalf of both WHO and UNICEF. Bruce Gordon was meant to be here this morning, but he's at the UN 2023 preparatory meeting in New York this morning, or this afternoon rather. So just want to say that, I'm really happy to be here. These guidelines are hugely important. And the idea for the guidelines was sort of born out of the COVID pandemic context, and particularly in the first few months of the pandemic, when governments were telling everybody to wash their hands and to wash their hands everywhere. And for those of us at country level, it was a quick realization that we didn't have a lot of handouts on what to do beyond schools and sort of hand hygiene in the home, some very basic guidance that we had. But I think having this more sort of normative guidance on what needed to happen and how to do it was really important at that moment in time. And, having that moment, it unlocked a lot of barriers in terms of supply chains. We had a lot of opportunities that presented itself from the private sector, and in terms of sort of the willingness of government to sort of break down barriers between agencies to make hand hygiene happen. But we really want to be in a position that, we capitalize on the attention that's been given to hand hygiene, so that the next time this happens, we're in a position to support governments to transition to hand hygiene very quickly. So this is all part of our movement to, better prepare governments for the next pandemic, but also to capitalize on the attention that's been given to hand hygiene and to make sure that we are better prepared for the future. So UNICEF's been really happy to work alongside WHO in pursuit of these guidelines and asking questions around things like, to make us more effective at supporting governments, what kind of guidance do we need to support the most effective hand hygiene? What are the requirements for inclusive reach for all people in all community settings? How do we effectively influence sustainable change in behaviors and social norms? And we have a particular interest as UNICEF, because of a lot of our country offices are working hand in hand with the Ministry of Health to support government measures that underlie these improvements in programming and behavior change. Under the Hand Hygiene for All initiative, which you may have heard of, that WHO and UNICEF spearheaded during the pandemic, it was an opportunity for us to galvanize national leaders towards this idea of universal hand hygiene. And today we have 60 countries that are engaged in this process of developing universal hand hygiene roadmaps. So this normative guidance would sort of fit in to that initiative that we're currently undertaking, and also into an initiative that we have under the Hand Hygiene Accelerator Framework tool, where we're measuring progress in the enabling environment that each country is making towards universal hand hygiene. So as this work progresses, we are equally focused on designing the guidance for implementation that will enable governments to operationalize recommendations, but also making sure that they are embedded within national systems to minimize the burden and optimize sustainability and the sort of future thinking around these initiatives. So as we near the 2030 deadline and the SDG targets, these guidelines are a critical step toward providing national leadership with the tool they need to accelerate progress toward hand hygiene. So on that note, I would like to kick off the session officially and to hand over to Erin, who is from the Global Hand Washing Partnership, and she'll lead us through a quick warm-up quiz to get you all thinking more about hand hygiene.
Okay. Thanks, Anne. Yeah, so as Anne mentioned, if I can change the slide. So hi, everyone. My name is Erin Palomares. I manage the Global Hand Washing Partnership. And for those of you who don't know what the Global Hand Washing Partnership is, we are a public-private partnership. We serve as a global advocate and knowledge hub for hand hygiene programming. So we've been doing hand hygiene work for over 20 years. Personally, I've been doing it for closer to 5, but it's always very exciting to see some progress around universal hand hygiene. So excited to be part of this session today. But yeah, I'm here to warm us up through a fun interactive quiz that'll test your existing knowledge on some key hand hygiene topics. Of course, you won't be graded on your answers, so there is a pretty low bar here, but hopefully it will get you to start thinking about some of the points that we'll be making throughout the session, and we'll get the discussion going on for later on. So first question, and I do want to make a note, we will be using Slido for some of these questions, so do keep your phone or laptop out. I think the slide will give you, if I change to the next slide, the code to it. So the first question is, what is the ultimate impact the guidelines aim to support? And again, you can join using slido.com and then entering the code, or I think you can also scan the QR code if your phone reaches that far. But yeah, the answers are A, reduction of diarrheal disease, B, elimination of AMR, C, elimination of neglected tropical diseases, and D, a state of complete physical, mental, and social well-being beyond absence of diseases. So we'll take a few minutes, get some answers in. Okay. See. So far, it's looking like a couple of answers are standing out: a state of complete physical, mental, and social well-being and a reduction of diarrheal diseases. We'll give everyone another minute or so, and then we'll discuss. Ooh. Okay. So, okay, well, the answers are ever changing, so I won't say the percentages, but it looks like a state of complete physical, mental, and social well-being, a reduction of diarrheal diseases. The answer is D, a state of complete physical, mental, and social well-being. Of course, oh, yes, D, a state of complete physical, mental, and social well-being beyond the absence of disease. Of course, there are several health and well-being outcomes that hygiene and wash more broadly contribute to, including A, B, and C, the reduction of diarrheal disease, reduction of AMR, neglected tropical diseases. And so the figure on the left of the slide here just names a few of those issues. And then to the right, we've just added some points from the State of the World's Hand Hygiene Report, which we talked a little bit about in the plenary session yesterday. And that just focuses on sort of the value proposition for hand hygiene. So looking at associated health, economic, and social outcomes. And just a note at the bottom of the screen as well, you can see that some new estimates on diarrheal disease and acute respiratory infections will also be available soon. So do keep an eye out for those. But moving on to the next question, and again, we'll be using Slido for this one. Hopefully it'll go automatically on your phone, but if not, then I think the slide will also show you how to enter again. But globally, what increase in current rates of progress is required to achieve universal access to basic services by 2030? So are we A, on track? 2, we need to double our efforts, C, triple our efforts, or D, quadruple our efforts? And we'll get some answers in. All right. Great. Yeah, so a lot of varied answers here. It seems like the top answer is we need to quadruple our efforts. Some people think that we're on track, which is great to hear, but unfortunately, not quite right. The answer is that we need to quadruple our efforts. So although most countries have relatively few data on this, for the first time, there were enough data to produce trends for basic hygiene at the global level, and for 4 of the SDG regions where data were available for at least 50% of the population. So if the current rates of progress do continue, the world will reach only about 78% of coverage with basic hygiene by 2030, which would leave about 1.9 billion people without access to basic hygiene services. So there is still a lot of work that we need to do, but certainly, getting everyone in a room and seeing how we can sort of accelerate that progress is just one step that we can take to make sure that we're moving in the right direction. Let's see. And here's just a slide with some of the JMP data that supports some of those figures as well. So this next question is a bit of a trick question, and we don't have a Slido for this. Instead, I just want to open it up for discussion because I think that there could be multiple answers here. But what is the main bottleneck in terms of system strengthening for hand hygiene? Does anyone have any thoughts around what are the main challenges when you think about hand hygiene at a systems level and from your experiences? Anyone have any thoughts? Henry? Yes.
I'm going to go with the political leadership. So unless you have a driving dynamo of
Great, thank you, Henry. Any other thoughts around that question? Ron?
this and that. Black.
Great. Anyone else? Go ahead. Right. Yes, definitely. And I know we've talked about some of that in some of the other sessions as well. So I can definitely see that issue coming through even within this conference itself. Did you have something to add?
No, I was going to say for individual people. We say if you don't have the extent of it.
Yeah, definitely. Well, thank you, everyone. Well, before I move on, does anyone else have anything? Oh, you. Yeah. Go ahead.
Like everyone agrees that what are the things that will support this?
Right. Thank you. Oh, go ahead. Yeah, Jeff, go ahead.
I encourage them to recognize the biggest problem that whereas what might be better avenue would be where political leadership kind of exists all in and then in other issues. There's a very strong chance that many of those issues are understanding.
Right. Yeah. Yeah, that makes sense. And certainly where advocacy comes into play, I think especially with hygiene being so cross-cutting, it can sometimes be hard to find where it's placed within government leadership or, which ministry is responsible for hand hygiene, which does make it our job a little bit more complicated, but certainly agree that, we need to see where there is already engagement and excitement around this issue and see how we can just go all in. Okay, well, thank you everyone for providing inputs. I have to say that was a trick question. There's no right answer. And that's because we don't have that much data on this particular topic in terms of, what are the main challenges in government action. So the information on the slides comes from the 2020 Glass Hygiene Highlight, but I do want to note that these data are pre-pandemic estimates, and I think there will be some new estimates coming out soon, so hopefully we can get some updated information there. But, we can use some of these tools to identify where there are gaps. I think in my experience, we're at the point where I've seen some commitment from some countries, certainly, but there's often a lack of sort of financial and human resources to implement those plans. So again, I think that comes down to really where the country is in their journey. I think it really just depends if hand hygiene isn't on their radar, then that's certainly an area where we need to really push toward. If the country is already well on their way with their hygiene journey and already has hygiene in their national plans and policies, and we need to look at some of these other issues like financing. So yes, it just depends. It's country specific, but I think there are a lot of great points that were brought out. So the next question, 4 out of 5 questions, what proportion of global recommendations on hand hygiene are evidence-based? And I think we do have a Slido for this one. So less than 10%, 10 to 40%, 41 to 70%, or 71 to 100%. I'm curious to see everyone's answers here. I don't know. Oh, there it is. So 10 to 40%. Give it a couple minutes. What proportion of global recommendations on hand hygiene? Yeah. Yes, are evidence-based. So it looks like 10 to 40% is at the top. Unfortunately not. It's less than 10%. So actually an initial scoping review of international recommendations found that only 2% of international recommendations are based off of peer-reviewed literature. And I know Joe will go into that a little bit more during the framing presentation, but oh, go ahead.
What we're reporting here is that 2% of recommendations from 51 islands that we looked at, the fourth is I have to bet I would have science work work.
Thanks, Joe. Shocked by the 2%. But yeah, the manuscript preprint link is available on the slides, and hopefully they'll be sent out after this so you can read a little bit more about the findings of that study. And then the last question here is again a bit of a trick question, and I think some people got into it in our last discussion even, but which ministry has the mandate to coordinate government efforts on hand hygiene across multiple settings? A, no leads required as long as the coordination mechanism is in place. B, coordination is overrated. C, Ministry of Health, or D, Ministry of Public Works. Does anyone have any thoughts there? I see a lot of deep thinking faces. Does anyone want to think out loud? Go ahead.
We have like Ministry of Planning where all the other ministries will be in one place. They listen the public works get started. They have some like all
Right.
collaborate, but I can find what ideas or what I can come from. So yes, and coordination is really important. Because sometimes to make an idea to have buy-in, there should be a collective action for that. And in Indonesia case specifically, they have this Ministry of Planning become the lead of a lot of work here that
Mhm.
we have on national level, central level, state level, that they can kind of like ideally go first from the bottom up.
Mhm.
So first coordination is really important, and sometimes not specifically one specific like ministry, but a structure to collaborate. And that's for work in general, but then for school, they have this different also kind of like ways to collaborate between Ministry of Health, Ministry of Education, and because these three ministries kind of like sitting in the same like level and power, we have this one ministry like oversee them all. So it comes like they have like different mechanisms for different like strategies for this because the context is really
Right. Yeah, thank you for that. Go ahead.
So, I think different countries will different in different countries and multiple you really need that your health.
Mhm. Great. Anyone else? I think you're both right on. I mean, you know, this is again another trick question because like you said, it really depends on the country in terms of who the lead ministry is. But I do think that it is important to identify a lead ministry for each country for hand hygiene. And it might not necessarily be Ministry of Health. I know these guidelines, the primary target audience is the Ministry of Health in many of these countries. But like you said, in Indonesia, that might be the Ministry of Planning. And so the more important thing is that coordination is not overrated. It's very much important, but we do need to identify someone or a ministry that can take this on as a lead. And with that, that is the end of our short five question quiz. Thank you everyone for participating. Hopefully not too stressful for everyone and hopefully got you thinking about some of the issues, but I will pass it back over to Joanna to give the presentation on the guidelines. Thanks everyone.
Thanks, Aaron. Okay, so I'm conscious that we've discussed a little bit about hygiene and, you know, a lot of you see lots of familiar faces in the room who have joined virtual sessions that we've had on this topic in the past and who potentially are quite well aware of what it is that we're doing as WHO and UNICEF. And so you'll just have to bear with us if that's the case, but we really are focusing on the discussion piece. So hopefully this presentation will be quite short and just bring us all up to speed to make sure that we're all at the same place to have a dynamic discussion. We've heard from Anne that, you know, obviously hand hygiene has always been a critical cornerstone of public health, but really in the wake of COVID-19, we saw this increased demand from member states for better guidance on, in particular, on what governments should be doing to ensure that when in future, for example, when we are issuing recommendations that the public wash their hands at key moments, that everyone everywhere is able to do that. They have the wherewithal to do that. They know what they need to be doing, when they need to be doing, and they can do it. They have the water, the soap, or the alcohol-based hand rub. And so in response to that increased demand, WHO has a mandate to respond to demand for recommendations and guidance when it comes to public health. And this is really where the guidelines have come from. What I want to do with the presentation is provide a very brief overview of the process that we've gone through. and then just give you a bit of information on where we currently are, in particular on what key questions we think are essential to answer with these guidelines and how we propose to go about that. It's been interesting to hear, on that question of the political leadership, we were already sort of moving towards, in my mind, kind of the implementation of these guidelines. So I just want to caveat the presentation to say, it's quite technocratic. So what we're doing here is thinking about what recommendations do we think would be useful to governments. But we have been doing a lot of thinking already on making sure that the guidelines we develop don't just sit and gather dust on a shelf, in this kind of cycle of panic and neglect when governments invest a lot of attention in something like hand hygiene and then quickly forget about it and go back to business as usual. So what can we be doing as a team now and as a sector to ensure that the recommendations that we do develop, that everyone in this room and beyond feel a sense of ownership over them, want them to be implemented in their country, and that we've identified some really clear mechanisms for that implementation. We're not going to discuss that in this session today, but there's this session is twinned with a session that the Global Hand Washing Partnership are leading on Thursday this week in the Azalea room at 1:30. And we'll be talking much more about that. So hopefully you can join us for that session as well. Okay, so WHO follows internationally recognized methods and standards for guideline development, really to try and ensure that the guidelines are of the greatest quality and are impartial and evidence-based. The first step in the process is for us to consultatively define the audience, the settings, and the outcomes. And so this scoping process is the process of defining what the guidelines will and will not include. So you need to determine what the area of practice or policy is, the interventions, the approaches, what your exposures are, what individuals or populations of interest, and what the recommendations are intended to affect as well. We did a huge amount of work on this because to get this right means that everything else will flow quite nicely. And so it's a very consultative process. And what I'll present in the following slides is what we arrived at, what our conceptual framework is, what our key topics are, and the questions that we think are important to tackle. But before I go to that, to note that the next step in the process then, once we have our key questions and our key areas that these guidelines will respond to and provide recommendations on, we then go out to retrieve and review the literature on these questions to understand what it is that we can say that's evidence-based. And the next step then is to bring together a group of external experts, and I'll go into that a little bit in a minute, to develop evidence-based recommendations based on this evidence, acknowledging that for a number of the questions that we've identified, and this will come up a bit later, there isn't a straight answer. It's not a question of collecting the evidence and then we know what to do. And so this is where the process that WHO follows and the experts that it consults really come into play, so that we're not left in a position where we can't make a recommendation for lack of evidence, but we're making recommendations based on expert opinion as well when necessary. So then we had the process of publication and promotion, and I spoke a little bit about this, but it's really the focus of the session on Thursday around how can we make sure that we are promoting and encouraging uptake of the guidelines, and then the process of ongoing monitoring and review as well, which is very critical. So you can read more if you have appetite for this kind of thing. Very dry handbook for guideline development that the WHO has published on the link there, but that's really the nuts and bolts, the crux of what we've been doing. And we do it very collaboratively. So these are the groups that we've set up so far. Actually, I should say the external review group is in the process of being set up. So if you're interested in being a part of that, please approach me or send me an email. So we have an internal group at WHO and UNICEF, which is from the global to the national level of individuals whose areas of work pertain or should really be linked to hand hygiene. So not just from the wash sector, but individuals working on cholera control, on child health, and other areas as well. That's the core group that's been helping us develop the guidelines and scope what it is that we want to focus on. We've also developed the guideline development group, more recently. So this is a completely independent group. There is no WHO or UNICEF representation on that group, and it's composed of external experts, of end users, so government ministries, and ultimate beneficiaries as well, representatives of ultimate beneficiaries. And this is the group that will be developing the recommendations next year when we come to having the evidence that we've gone out to retrieve. The external review group, this is a group that we're just in the process of setting up now, and it could be any one of you, and I acknowledge that a number of you may already be involved in the guidelines in one way or another, but as I say, do get in touch if you want to be engaged through that group. And then we have our systematic review team, which is the team that is pulling together the evidence review as we speak, and I'll come back to those. Right, so very quickly, you can see on the top right, because I'm conscious that this is a lot. So on the top right, that process that I presented in the first slide is just summarized at the top, and we're currently looking at that scoping stage of the guideline development process. First thing we did was develop a conceptual framework, and you can see in the bottom left-hand corner that the first thing that interests us is understanding what effective hand hygiene means, and understanding on B, so the bottom right, what outcomes it might impact, and going from the individual, the population, to the societal level, and looking beyond just health as well to that broader WHO definition of health, which includes well-being as well. And in the middle, you can see there's a modified, very small, modified F diagram that just tries to capture some of the other modes of transmission that might be relevant to us. And on the C, in terms of the intervention, well, what interventions can we and should we be delivering to improve the practice of effective hand hygiene? Now, I don't know if I can use a little, no. So just here, just a quick point to say that we're using Suzanne Michie's behavioral theory, and so that's what's underpinning this conceptual framework, and looking at really what drives behaviors. So capability, that you're able physically and psychologically to practice hand hygiene, motivation, that you're motivated to do so, and opportunity, that you have the wherewithal, you have what you need to do it. And so these are the core intervention components based on that. So we've got this, in fact, I won't start with that one, I'll start with this one here, that people have the minimum requirements to practice the behavior that we're asking them to practice. They have running water, they have soap, or they have appropriate alternatives, and that they have the motivation to practice the behaviors. This is around the behavior change component of interventions. And then the third component is around the strengthening of the enabling environment. And those of you who were aware of the Hand Hygiene for All initiative that Anne mentioned at the beginning would know that these are the three pillars that that initiative was grounded on. So I won't go too much into the detail because apart from anything else, it's quite hard to read, but feel free to discuss, to ask questions, or you can look at the slides after. Based on this conceptual framework, we simplified it right down and pared it back to these 5 priority topics that you can see on the left. So looking at understanding when, how, and with what products and services hand hygiene should be practiced in community settings so that it's protective of health. Secondly, looking at what are the minimum requirements to ensure practice of effective hand hygiene in community settings. Third, what are the key components of sustainable behavior change approaches for hand hygiene in community settings? And fourth, what measures should governments adopt to ensure that minimum requirements are in place and also sustainable behavior change approaches? And we also, during this scoping phase, explored what we mean by community settings, which specific contexts we're interested to look at. So this notion of community settings was really born out of the fact that WHO has very robust guidelines to offer healthcare professionals. So hand hygiene in the healthcare setting is a very particular beast, and we have strong guidance for that. What we were lacking, and really became apparent during the pandemic, was guidance for community settings that are not primarily geared towards providing healthcare. And these, we've simplified them according to 3 main blocks. So the household being one, And once you sort of exit the household, public spaces, whether that's transport hubs, shopping areas, marketplaces, and others. And then moving into institutional settings. So looking at schools, workplaces, or prisons, for example, and acknowledging that for a lot of these, the term institutional settings is perhaps a bit grand. Okay, moving on. So once we had those bulk priority topics identified, really what we wanted to do is understand within these key questions here and these top line questions for each of them, what were the sub questions? Because what we don't want to do is develop a tome, develop a Bible of hand hygiene that no one picks up because it's so big and so dense, and that includes a lot of information that people already know. So the idea was, in our process of scoping out the guideline, to identify within those areas what are the burning questions that need answering, and for which we don't yet have adequate guidance and recommendations. And this is where the the scoping review of international recommendations came into play. And so, as I said before, we identified 51 global guidelines that provided recommendations on one or more of those 4 key topics that you can see headed in green there. And we looked and categorized all of these recommendations and identified areas where there was consistency, areas where there was inconsistency, and areas even where there was discordance. And we also identified the gaps. And I'll go into them briefly because it's interesting and it helps frame the following slides, where you can see the questions that we have gone on to identify as being key. So in terms of hand hygiene, effective hand hygiene, there was consistency with the duration of washing for 20 seconds or more, and the use of alcohol-based hand rub as an effective alternative. Where there was inconsistency was around when to practice hand hygiene. So what are those key moments? So guidelines recommended over 30 individual key moments across community settings. And there were gaps on this question of how to practice effective hand hygiene. When it comes to the minimum requirements enabling people to practice effective hand hygiene, the consistency we saw was around recommendation for soap and water, as you might expect, to single-use paper towels for drying, and for ABHR with at least 60% alcohol content. The inconsistency came more around the design and the location of hand washing stations to ensure that they are durable, sustainable, and that access is equitable to all. Discordance, we saw discordance around what the quality of water required for hand washing, and the use of alternative products such as ash and a chlorine solution as well. And in terms of the gaps, we didn't see any recommendations coming out quantifying the amount of soap or water that you need, which, when I saw that, I wasn't very surprised. It's probably quite a difficult thing to do. Okay, so on to behavior change. We can see the consistency around behavior change messaging and delivery channels, and also around behavior change techniques, so using prompts and cues and habit formation. The inconsistency that we identified was around behavior change approaches and the determinants of hand hygiene practice, as well as behavior change models or frameworks. And there was a gap in terms of recommendations for the frequency with which you should be targeting individuals with behavior change messaging. And very quickly on government measures, I will say the first thing to say about government measures and recommendations is that it was the area or the topic for which we had the least amount of recommendations available. So there were significant gaps in sector policies and strategies that would be effective in improving hand hygiene coverage and practice, on sector financing, on planning, monitoring and review, on capacity development, and on equity. So what you can see is there's nothing there on areas of consistency or areas of inconsistency or discordance. So really an area that we really need to be focusing on for the guidelines, and a key reason for sort of justifying having guidelines focused on targeting government agencies. And I already explained the piece on the evidence, so I won't go there. So the next 4 slides just summarize what the questions are for each topic that we've identified as needing response. The first 3 are grayed out because they're really what we'd call background questions in terms of the guideline development process. They're not questions that are going to determine whether a recommendation is X, Y, or Z. They're really framing questions that help us understand the importance of hand hygiene and to what extent it's significant in reducing the burden of disease, for example, and cost effectiveness. So very much around sort of the value proposition for hand hygiene investments. So question 1.4 really gets into it. So which hand hygiene products are effective at removing or deactivating pathogens linked to the transmission of different diseases in the community settings? And we're looking at how effective soap products are, and where soap and water isn't available, what appropriate alternatives there are. I know there was a session, someone told me there was a session yesterday that was reporting on a study that shows that ash could be an effective alternative to soap and water, but really trying to take a broader sort of systematic approach to the literature on these questions, and which hand drying methods are effective as well at preventing recontamination of hands. And then on the question of minimum requirements, this question of key moments. So are there key moments for practicing effective hand hygiene? Are they clearly identified in existing global guidance? And if so, what are they? And also, what are the minimum requirements for the sustained practice of effective hand hygiene in community settings? So we're talking here about what quantity of water is needed, what the quality, microbial quality of that water should be, what the quantity of soap is that's required, and also where that soap and water should be located to enable people to wash their hands at those key moments that we will have identified. Also looking at optimal spacing and number of users per hand hygiene station. So this is obviously very relevant for example, school settings where there are a number of people wanting to wash their hands at particular times. And question 2.3 is a very broad question, which I found sort of encapsulates a number of different challenges that we find, and so really needs to be unpicked. But what are the principal design considerations for hand hygiene facilities to ensure equitable access to the minimum requirements and equitable access to behavior change campaigns or interventions? And so here it's really to make sure, you know, an example would be if you place a bar of soap in a community setting where theft of soap might be quite high, do you need to think about how you're doing that so that you can reduce the likelihood of the next person not having a bar of soap when they need it? But there are all sorts, you know, thinking about people living with a disability, having the right height hand washing station available to them, kids, the elderly. So a lot of things that are encapsulated in this question. Also questions of climate change and the sustainability of hand washing facilities that we provide. So topic 3 around sustainable behavior. So the 3 broad questions here are first, understanding what drives behavior. So that's 3.1. What are the key behavioral barriers and enablers to practicing effective hand hygiene? The second one is around what theories can we use to effectively leverage those determinants, those barriers and enablers in our settings of interest. And the third one is, well, if we understand what drives behavior and what theories we can use to leverage that understanding, then what are the actual functions, what are the interventions that we're looking at to try and tap into that? And I, just for lack of time, I'm not sure whether I'll go into those sub questions, but they all really build on that top question around what types of interventions are we looking at. And finally, for government measures, really what we want to understand from the literature, and we've really cast the net quite broad here because there's such a dearth of recommendations, and we know that the published literature is so weak on this. We don't want to limit what we can get from evidence retrieval phase by making very specific questions. So we're looking here at what government measures have successfully been implemented at scale to provide the minimum requirements that we've identified and to ensure the sustained practice of behaviours. And what we'd like to do is use the frameworks that are copied on the right there. So the Global Acceleration Framework for SDG 6 and also the Sanitation and Water for All building blocks for the enabling environment to assist us in looking at this literature in a systematic way and trying to draw conclusions or bring out interesting recommendations when it comes to government measures. So the first question is around what measures have successfully been implemented at scale? And the second question is what measures have been successful in ensuring minimum requirements? So a much harder question to answer, that issue of causality, which I think when it comes to government measures is quite difficult to tackle. So I'm conscious this is a lot of information. We've got a couple more slides and then it really is over to you to discuss and ask questions and contribute your ideas. We have been through a consultation process already for these questions. So the questions are final. During September last year to May of this year, we consulted the Hand Hygiene for All Global Partnership. We consulted the Global Hand Washing Partnership's broad membership and their specific task force on hand hygiene in community settings. We consulted the COVID-19 Behaviour Change Forum. So I'd cautiously say that we've consulted a vast number of the organizations present here today. And what we're planning to do in the first quarter of next year is to have an extensive period of consultation with government ministries and in-country supporting agencies as well, and more on that soon. So I just wanted to post some of the main discussion points that came out of those consultations, and the report is currently under review and should be published in the next month or so. There was a concern that we very clearly identify definitions for the community setting. You know, what settings are we talking about, what's in, what's out, and why? And to identify differences among community settings or between community settings, acknowledge those and find a way of talking about those in the guidelines. Because we set ourselves a big challenge. What we can't do is have a guideline that goes into each and every one of our settings and provides specific tailor-made recommendations. But how can we provide recommendations that are both fit for purpose for different settings, but also sort of that are generalizable, but also provide not too generic, you know, provide something that governments can use. In terms of the minimum requirements, which hand hygiene products and types of available hand washing infrastructure will be considered for the guidelines? And this is really a variety across different settings and certain contexts. And the key will be, again, in providing the users the tools with which to go and tailor their own interventions as the setting requires. And there was a recommendation that we ensure we're addressing sustainability and climate resilience, especially in relation to water use. On behaviour change, again, this plea that we think very clearly about definitions and to frame behaviour change so that it focus on how systems can be designed to enable behaviour change within a context. And also the critical importance of context when making recommendations on effective behaviour change approaches, which, you know, the risk there is that you can't say anything in your guidelines because, of course, behaviour change approaches need to be incredibly tailored. So what role is there for the guidelines potentially in providing recommendations on how to effectively design an intervention for your local setting? And then on government measures and government as a target audience, a number of people have flagged how important it's going to be in the guidelines that we capture the broader ecosystem of actors for hand hygiene, especially as it's so cross-sectoral, and that we map that before then going into, well, what's the specific role that government can play within that? And that's something that we've taken on board and we're working with the Global Hand Washing Partnership already on doing. Okay, I'm conscious of time. I don't really want to go too much into this, so I'm going to skip a few slides, but you have access to the slide deck if you like. Really what we've done with those questions is we've gone to the evidence and done a very rapid scoping review to identify which questions are readily answerable with the literature and where we need to go out and do evidence retrieval and evidence review. So that's what that slide says. And the next slide is just an example of how we've done that. So you've got the questions you can see there listed, and then really a quick snapshot of what evidence is available already and where we need to go out and undertake a new systematic review, as in green. So the results of that process are here. We've commissioned Emory University to carry out after an extensive selective process, we commissioned Emory University to carry out review and synthesis of these 3 terms of reference, and you can see the key questions which have come out as not currently being readily available, systematic reviews not being readily available at present. And we're really excited to be embarking on this work now. We have Bethany Caruso in the room from Emory, and we're also working with Marlene Wolf and with, oh, I didn't see you there, and with Matt Freeman. So really excited about that. And just a quick dramatic slide. We need you if there are studies that, you know, for some reason you haven't yet published, they're in the pipeline, or you're worried that, you know, you've got a study that might not kind of come up in the grey literature search, then let us know. You know, spend 3 minutes. There's a Google form there. There's a Google Drive that you can drop documents into, so that they can be treated in the review process by Emory. And then very quickly, next year, once we have that those evidence summaries for each one of our questions, then it will really be up to the guideline development group to assess the quality of that evidence, to assess the extent of that evidence, and to help us develop a set of recommendations. And I won't go too much into that because it just seems so far in the future. This is the framing for the next session on Thursday. So again, I think I'm just going to leave it there in the interest of time. And I'm not going to show you my backup slides. So, okay, so can I have a quick look at the agenda? But I think essentially it's over to you, Anne, isn't it? So.
Okay.
So thank you, Joanna. So thanks to Joanna, I think we got a great overview of the process, the content, some of the big questions, and we just wanted to stop and see if there are any questions for Joanna on anything that she has presented. Because I know there's a lot there and quite detailed information and a lot to absorb. So is there any questions of clarification or content that need to be resolved? Okay, so it sounds like that was clear. Yeah, crystal clear. And maybe then we just wanted to go into more of an open discussion with everyone. You know, so now it's not so much on, you know, the specifics of what's happening, but just, you know, any sort of broader thinking you have. Like she presented the 4 areas, right, around behavior change and sorry, I could write my 4 areas down: the behavior change, the minimum requirements, effective hand hygiene, and then policy, and what they're doing to collect the evidence around that. And just wanted to see if this all makes sense to you. Are these the right areas? Do you know, does this all sort of gel in terms of a process for coming together? And maybe just I would kick off with a question that I have, and you know, that I have also been part of the process, but it is a question that's come up continually, I think, as we've gone through this, and I have been working on hand hygiene since the formation of the Global Hand Washing Partnership, when it was called the Public-Private Partnership for Hand Washing. You know, we know we have a lot of evidence on behavior change. We have evidence on the minimum requirements, but the area where we don't have as much on is policy. So I guess the question for you, Joe, is, you know, what are the main sources of evidence that are driving evidence retrieval for policy, and how can, you know, countries that are in the midst of doing this work on hand hygiene, how can they contribute to the development of this guideline?
I think this is really where having UNICEF as a UNICEF have more people as well, and intensively tested this, because the 50 countries specifically the hand hygiene, a huge amount of learning that we need to do on the innovation that that leadership, the way how do we make sure we don't lose that, to develop a set of guidelines that build on what we've learned from country experience. what we are trying to do as WHO is make sure that those processes, those learning processes that are happening in the country, that they can feed into this review and people review and synthesis process. Of course, the challenge that they face there are multiple challenges of policy. One is that publications are out there that they're simply not indexed processes and may not come up. We can address that. We can use our network partners. We can use all the tools to make sure that they practice it. We will talk to the network. Not to worry about that. I think the next challenge is that the policy documents that we do manage to find, by then, by the late nature of that, that we're going to struggle to synthesize and going back to the policy of those documents, maybe challenge purely because areas. And I think that's where working with Emory, there are ways that we look at this very much develop. But ultimately, that looks at these very other areas as a life that we can actually. But what we're determined to do is to still make it. Because a lot of people are, they're common sense in many ways, and there are frameworks already available in the WASH sector that help us outside of what we finance. Good coordination. People recommendations and we can go on a wealth of experience with the case studies as well to help us rectify that. Really I wonder if that can be I realize I probably should have talked to you. No, maybe there's a timeline of what we're doing with the back. And then it goes into the like intelligence, and then have that evidence. Whether the policy, whether the policy is challenged and still go forward as it's that I think we'll see what we have on.
And again, I wanted to open it up to others in the room who have programming in countries and ask you, I mean, are there other ways we could be cultivating those experiences in such a way that they could filter up into this guidance and be reflective? Because we are looking at community settings, but I think what we have found in this process, there's a lot of people that work on hand hygiene, and there may be pieces of guidance, pieces of policy that relate to hand hygiene that maybe don't fall squarely in the places that we've been looking. But I think this is the challenge. How do we find those fragments of directives, of guidelines that governments are issuing to contribute to that? So, okay, so just I think maybe then kind of going to another sort of framing question for you, Joanna, and maybe Bethany is, I think when we look at the process for developing a guidance document like this, it's almost as important as the recommendations that will come out of the document at the end, and particularly when we're talking about other sectors like health and education. How are you framing this in such a way that it will be easy for those sectors to take up the recommendations in a meaningful way?
this is something that, yes, we spent the last 50 years on the code, and other elevated that, but the delivery of the recommendation needs to be elevated. This is the first step. This is the really seen it the last consider out that, you know, the practice of my country is waning slightly, and people's interest and financial training. And we're developing these guidelines, and they take a long time to develop, and then they come out. So it's about, you put it really well, it's about training the family, what they're doing, and then having these recommendations available to compare. So one of the things that at the global level is very easy to do is identify the example, 51 guidelines for this. What conversations do we have with people who publish these guidelines to see where the areas that are feeling the effective so at the country level, it's even we develop a separate global guidelines which then reference embedded in other guidelines. How is that about the country level? Ultimately, ministry of health, other
Mhm. Okay, I wanted to open it up now just to hear from those of you who perhaps were active in country response efforts during COVID. What were some of the requests for support and guidance coming from government where you were working? Where did you see the biggest demand for this kind of guidance or protocols to go back to business, to go back to schools? Are there any insights that anyone wants to share? Because I think this is a good opportunity. These are normative guidance that are going to go out globally. And I think it's a great opportunity with all of you here with all this experience in the room to share some of your insights.
But one of the
Right. Mhm. Right. Yeah. Right. And yeah, so this idea of the supply chains around hand hygiene, I think a lot of us experience that. Yeah, in the back.
Right. Great. No, those are really great insights into, I mean, again, I think echoing this, the deluge of hardware that's required in a response effort like this, that's needed, but also the M&E, who's responsible for these stations once they are up, and who's monitoring actually whether they're being used. Yeah, Henry.
Yeah, right. My concern is twofold. One is the problem the functionality process to I wonder if it is a role for government to rule that I wonder that everything the same countries that have maybe dramatic rate of circulation of the or why the guidelines
I think that's a great point, Henry. Joanna, shall I take one more question and then you can respond if you like, or would you like to respond now? Okay, let's take Jeff.
Okay, thanks. My question, I'm not responding to your question, I guess I wanted
No, that's fine. You can go ahead.
that, some simple, that I saw because that's really a difference. And, during last, all my friends, one of the overarching things about it is my education not very process to develop their own someone end up with a lot of over the last 6 months for the core learning it was 3% compensation for benefit projects and they're very keen to take very simple on what employees young the recommendations for one often management models and as far as these they're really challenged to design standards and assessment. So you give us those things figure out more than those standards, but not standards to it. Help design more to concept. And a lot of people I know have sitting on top on So that's a big challenge for us.
Yeah.
And those efficiencies have school on and monitoring. So they're not washed. So one of the avenues is sort of most mindset perspective is that just be smart and actually not to be that will let you use and focus on the environment to solve climate but they need more that's a lot, I know, but it's sort of big theme of how to connect that you branded from the walk and into the land development land all states and all of this something we run them.
So I'm going to hand over to you, Joe, to maybe react to some of the comments from Henry and from Jeff, and maybe some of the other comments as well. Oh, we do have actually one hand in the back. So yeah, good idea. Yeah. Okay, great question. Oh, Joanna, I think people can't hear you. There you go. Yeah.
Yeah, I was just saying every time we have one of these sessions, I worry that, there won't be enough meat there potentially to have a stimulating discussion and people won't be engaged. And every time I'm proven wrong, people teach me things to think about, which are really important. And Henry, you make an excellent point, and it's something that keeps being pushed down my to-do list because it's a really difficult one, but sort of learning from governments who have implemented really effective national behavioral campaigns, and how have they done that? And I just miss Val Curtis every day, because she would have been the person I could sit down and she would just have all of these examples to read off to me of work that she'd done with governments to help, whether it would be the government of India or Tanzania or others. I think at least there's space within the framework that we've developed for that discussion, but I do agree it will have to be really purposeful. So where I think it fits is within the behavior change pillar and thinking about what motivates people to adopt sustainable behavior, for the sustained adoption of this behavior. It does have to be, we know it has to go beyond health concerns. We know it has to be aspirational, and people have to feel like it's an important thing to do for them, unfortunately, not just for the health of others. And so I think this question of aspiration, I really like the slant of modernity. We need to sort of think about, well, firstly, hopefully the evidence retrieval phase will deliver examples that have been written up. I know certainly Val, for example, wrote up a number of things she did, but hopefully also the networks will help us bring this together so that we can provide the tools. But it's interesting because it's sort of what Jeff, I think I understood what you were saying, Jeff, is that keep it as simple and pared back as possible. So, you know, the temptation to write a guideline that then goes into detail around how you might design a national campaign that's based on principles of aspiration and modernity. Just thinking about how to do that in a simple way, I think, is the challenge. But the way at the moment, the way, you know, Heather, who works with Anne and myself, are thinking about this. And it's a shame Heather's not here today because she's done heaps of work on this, and she's really sort of leading the drive and thinking about implementation mechanisms for the guidelines. And I think what we're going to need to do is develop a set of guidelines that are just hand hygiene specific for those of us who can't get enough. You know, we're going to go into the detail, we're going to write a lot about these things and expand on them. But what's going to be critical, I think, is then, like Jeff said, identifying in the sectors and the settings that we want to see uptake, identifying specific uptake strategies to engage these different sets of stakeholders. So for the school setting, you were talking about, you know, overall well-being of children. I think that's what we need to tap into. We need to understand what frameworks exist already, and hand hygiene is one of a number. We've got toothbrushing and I don't know what I don't know what else. But one thing that GHP is helping us with is we're going to develop a series of workshops, setting specific workshops in the coming 6 months, where we bring not the washies, but the others into the room to discuss, okay, so for you, where does hand hygiene sit within your kind of your work, and what do you do currently, and what's possible to do a bit more of, and try and have those conversations. And then Marlene, I think you raise this important point about kind of a shift in perception of what hand hygiene is critical for. And luckily we have a new systematic review coming out quite soon that provides much stronger epidemiological evidence linking acute respiratory infections with hand hygiene, or vice versa. So I think that's going to be quite a critical piece, and it's now been added to the burden of disease estimates that report on SDG 3. So we have the tools, but it's all about communication now. And I think that the guidelines will provide us with a really good opportunity to start talking about these. And I think it will come in at different points in the guidelines. So in the value proposition and the case for investment, yes, but also when we start looking at key moments. So we've obviously, because of the pandemic, we started seeing different key moments for when you should wash your hands, because respiratory infections transmit in a different way. And so I think that's another area where we'll see it coming through as well. But the comms is going to be really important. I feel like I've spoken a lot, so I'm gonna.
Well, I think that's been a really great sort of expose of this process and you know, the guidelines that are under development, and this process will be going on now, I think, for another at least half a year, right? It's a, yeah. So, so this has been a great touch point, I think, with others. I don't know if anyone else had any other general comments they want to make before we go to closing. Please go ahead.
It's not the only thing, right? So we have to avoid pushing the responsibility only to the community. Some use cases for the part, so we don't have to.
Anything else? No. Okay, great. Well, thanks so much to all of you for your attention and for your enthusiasm for hand hygiene. I wanted to invite our colleague Maleku, who works in Ethiopia, and will come and close the event and share some parting remarks.
Good afternoon, everyone. Yes, for me, it's a second opportunity to stand before you, and I'm happy that this opportunity is brought to me. Yeah, so in Ethiopia, so COVID came, and you know that close to 100% of Ethiopians are eating their food with their own hands, not forks and like spoons and like that. So you might have heard that injera is our famous food. So injera is a type of bread, broad one, and you have to eat it with your hands, with all the fingers. So you can imagine our hands is going everywhere, into your head, into your pocket, and everything. So how are you going to eat food with your hand? So that is a very critical situation, considering hand hygiene in Ethiopia, because you are eating with your hand at the same time you are going to the trash with your hands. So this is really critical to the Ethiopian population. And so after COVID came, there has been a lots of shouting in the town in Addis, because people are so scared. So I think that has necessitated the government, especially in the Ministry of Health, you know, to do lots of promotion. So in every building, you would see a lot of hand washing stations and lots of cars rented where, you know, doing some promotion work to communities that this pandemic, if it enters in Addis, then it's going to be a disaster. So we have really seen a shift regarding hand washing after the COVID. And at the same time, the private sector was really involved in the provision of the facilities. At the same time, soap and all those protective equipments where, you know, it's been an opportunity also for the private sector to work for this purpose. So, and you also see the ministerial level, the ministers, they were in their car with a microphone. So going to each village and shouting about the COVID, so that they have to wash their hands with soap and all those things. So it's been very amazing how the promotion work has been done. So the Ministry of Health was really coordinating all these activities to prevent or minimize the problem with COVID. And also they were giving data on a daily basis how the situation is, you know, in the country. So this is really important, I think, for which initiates, I think there has been no guideline regarding this thing. There has been here and there some small guidelines how to apply, but there has been no comprehensive kind of guideline that really dictates how the hand washing should go and what tools to use. So in the Ministry of Health, there is this hygiene and environmental health technical working group. So this technical working group was in a position to, you know, review and like decide on what kind of guidelines should be there in the country. So it's headed by the Minister of Health. I am part of that technical working group. So development partners, NGOs are part of that technical working group. So the WHO and UNICEF guideline has come through the Minister of Health. So we were called for a meeting to review this guideline. So unfortunately, I was not there due to other commitment. But finally, it was launched very nicely, I heard. And finally, the document, the guideline is in my desk now. So yeah, so there is this kind of reviewing of guideline, and the guideline is already launched in Ethiopia. So we will see how it will be implemented sustainably. But it's also very good to give this kind of direction for Ethiopia. And I would like to end my my speech by saying that there are two issues, two stories, I would say, one from the rural Ethiopia and one from the urban. So let me start with the rural one. So there is a farmer community, as you know, Ethiopia is like 85% of the community is rural and farming. So a farmer will only wash his hands before eating. So once he came to the urban area, to the town, to visit his cousin, and he was given a hand washing. He was provided to wash his hands, and then he was happy. He washed his hands and he sit for food. And then in the town, there is a practice that after you eat, you have to wash your hands. So after that, farmer had eaten and the food is finished, then he was offered for the second time to wash his hands. And then he was surprised. Why are you bringing the water now? I have already eaten. Is it for the second time? You know, so they think that, so washing before eating is only enough. So for them, washing for the second time is like not an experience in the rural area. So this is so do we really think that this guideline will answer this kind of behavior? That's one thing. And in the urban area, there has been a training for health professionals. So in that training, hand washing practice has been monitored. So there has been a hidden camera in the restroom. So people were told to wash their hands. A soap was also available in the toilet. So when they come back, the facilitator have in his hands the video. So he showed them. So nobody, imagine they are health professionals, nobody used soap. Of course they have washed their hands, but nobody has used the soap. But there was one. And they zoom in and want to see who is that person. And that person is a person who is working in the garage, because his hands was full of grease and like that. So in order to get rid of the grease, he has to apply soap. So you can imagine, even health professionals are not like applying the necessary tools, which they are supposed to promote the community. So I would like to say thank you for WHO and UNICEF for providing this opportunity. Thank you very much.